Hi, welcome back to Meet Your Body. I am so excited for our guest interview today. We are talking to Dr. Eleonora Teplinsky. And when I knew I wanted to do a series on HRT, on women making choices for themselves when it comes to hormone replacement therapy, I knew that we needed to discuss history of breast cancer, survivorship, what that means, and what kind of questions you can ask around HRT if you are a breast cancer survivor. And Dr. Teplinsky was number one on my list to bring to you guys today. I discovered her on Instagram, as so many people are on Instagram now. I discovered her months ago and immediately was drawn into her content. It is science-based. She sees patients in real time. She is right in it with her patients. And she is absolutely advocating and passionate about survivorship. And we will talk about that. But basically, survivorship means, what does it mean for cancer survivors after treatment? Long term, maybe you still are undergoing treatment, but what does it mean long term to feel supported in your body in that survivorship era? So we talk about that today. And then HRT is just a small part of that. We'll discuss what options you might have, and more importantly, how to advocate for yourself and how to know what questions to ask your doctor. So let me tell you a little bit about Dr. Teplinsky. She is a board-certified medical oncologist specializing in breast and gynecologic oncology. She is the head of breast and gynecologic medical oncology at Valley Health System in New Jersey and a clinical assistant professor of medicine at the Icahn School of Medicine at Mount Sinai. You guys, she knows what she is talking about. Her clinical and research interests focus on young women with breast cancer, cancer survivorship, and the use of social media in oncology. She serves on the medical advisory board of Living Beyond Breast Cancer, is a frequent media contributor and speaker, and is the host of the Interlude podcast, where she shares the stories and experiences of those who have been affected by cancer. She's also working on her first book, Beyond the Pink, which will be released in 2026. I feel so honored to have had this conversation and to be able to share it with you today. So here we go, my conversation with the amazing Dr. Eleonora Teplinsky. Hi, everybody. Thank you so much for being here. I kid you not, this is an episode I have been so looking forward to. And Eleonora can tell you I've been bothering her by email. I'm like, just checking, but it's only because I personally wanted this episode. Like, I wanted to sit and talk to you. And I'm so excited to get the information out. So thank you so much for taking the time today. I know you're in your office, you're seeing patients. So I really appreciate you being here on Meet Your Body.
Thank you for having me. I'm really excited to have this conversation.
Can you tell everyone your story, like whatever part of your story you want to share? I mean, the basics for definitely who you are, what you do, but also like how you got to this point and why this is such a passion for you.
Absolutely. So I'm a breast and GYN oncologist. So I specialize in really treating those disease types. I've been practicing oncology. I graduated fellowship about almost 10 years ago now. So it's been quite some time. And, one of the things as I started practicing, I realized that, the pieces that were missing were the survivorship pieces, the pieces that we weren't trained about, taught about. We were really well trained to give chemotherapy and put people on medications like tamoxifen and aromatase inhibitors, but we didn't really know, well, then what? And people were coming into my office with symptoms of vaginal dryness and hot flashes and mental health issues, body image, and we were really kind of learning together because I couldn't send these women away because they were suffering and I wanted to help. And then I started posting on social media thinking, well, if one person has these questions, I'm sure a lot of people have these questions, and I didn't have time to talk about everything in the office. So I said, I'm just going to put all this information out here and hopefully and start. And it kind of evolved into something that I think is hopefully a really good resource for others, but has taught me a lot as well about what breast cancer and cancer treatment in general is really like, what people go through. There's so much you don't necessarily say to your doctor, or don't have time to say, or won't say in that 15 minutes. And so by interacting with women and men, but with people who are not my patients, I get to hear a lot more of that and realize, all right, where are the unmet needs? What are the topics that we're not talking about and need to be talking about?
Yep. And I will say you all need, and we'll have all the links below, but your Instagram page is one I search out as a healthcare practitioner myself and as someone who has had breast cancer and has been through it. I go there to be informed about what questions I can ask my own oncologist and can ask my own doctor. I mean, you are on the front lines with research, with any article that comes out. I feel like you are talking about it the next day. And as a survivor, that is so important. And like you said, to have someone, because you leave that doctor's office, especially if you're in the midst of a cancer diagnosis, you leave the doctor office in a fog. You don't even know what questions you ask. Like, you don't know what you missed to ask. And so you think to ask them later. So I will just say thank you for providing that information. It's so important. And I love your passion for survivorship. So let's dive right into that. Can you tell us, like, what is survivorship? What does that mean? What does it mean to you? And how, for those of us who have been through a breast cancer diagnosis, what does it mean for us going forward?
So there's a medical definition, and then I think what it means to an individual person. So the medical definition is really you are a survivor from day of diagnosis because you are surviving with that disease. A lot of people take survivorship more to mean when they're done with active treatment, and everyone has a different comfort level in whether they want to define themselves as a survivor or not. A lot of people, especially patients living with metastatic or stage 4 cancer, like to use the word thriver instead in this movement of thrivership. Then you also have previvors, people who are certainly impacted due to a genetic predisposition or strong family history and have to make a lot of difficult choices and treatment decisions, but haven't actually been diagnosed with a cancer. So there's all these terms. And I think, I really think about, for me, what it means is what is it like to live with either active cancer or having had cancer in the past and dealing with all of the issues. And I think that's the part, is that when the dust settles, or whether you're on active treatment or not, all the other thing that helps us to survive and live with that cancer, and that's okay, our heart, our bones, our brain, our mental health, our sexual health, all of these topics that become really, really important.
Yep. And I saw a recent post that you did, and I thought it was so important. You talked about, you had a list of questions and of issues that many people face afterwards, such as you're living, right? Like, you are surviving. And so just be thankful for that and just deal with that going forward, and don't worry about these other things that you might be feeling. And I thought that was such a good aspect that isn't talked about a lot, because there is so much gratitude when you have gone through it, when you see other people who are still fighting and you've been through your treatment. But just to acknowledge that is really important. I think that there are lasting effects that, yes, even if you've been through your treatment, you can have gratitude. And at the same time, you can recognize, you know what, these are still things that I am going through that I can deal with.
Yeah, I mean, I think in that post, I was really highlighting also some of the things that people have been told that are not right in that phrase of, well, why are you complaining? You should be grateful. No, and just like you said, you can be grateful, and you get to think about, all right, well, what was affected? I don't want to suffer. I want to have a better quality of life. And so I think that the days where we didn't address survivorship and we left women to just fend for themselves, those days are behind us, or at least I hope that they're behind us, and that we're moving toward a point where we say, okay, we got rid of the cancer. There is a chance it can come back, but it's gone. Or you're living with cancer and you're continuing on treatment. But wait a second, what about your day-to-day life? What about your long-term health, right? How are we thinking about that? Yes, your cancer may be not active or controlled on a medicine, but if that medicine is causing you to have diarrhea, 3 times a day that you're afraid to leave the house. You're waking up drenched in hot flashes. You have brain fog. Well, can we make that better? How do we improve your quality of life? And that to me is really what survivorship looks like, short-term and long-term ways that we can focus on quality of life, longevity, and all that encompasses.
And do you find when someone comes to you with those issues, does it tend to stay within your realm and your scope, or are you also using a broader team of, all right, yep, let's send you to pelvic floor physical therapy if that's something that's going on, or let's send you to a functional medicine doctor if we need more hormone testing? Or how do you kind of approach that when someone does bring you some of these concerns?
Yeah, I think it's really a team, and everyone's team is going to be a little bit different. Physical therapy is such an incredible resource, and pelvic floor PT and just general PT, especially for people who are fatigued after treatment, who may have neuropathy. I mean, physical therapy really can get the ball, rolling in that regard. But no, it's so what I view my goal is like, all right, let's evaluate what you're dealing with right now, what you may be at risk for in the future, and let's get you set up with the appropriate people. Now that's not a one-time thing. It may be, well, what are the 2 issues that are really most pressing right now? So maybe it's you're really struggling with your pelvic floor. So we're going to focus on sexual health and pelvic health. And maybe in the future, we know that the medicines that you received may increase your risk for heart disease. So maybe we think, all right, in 6 months, we're going to think about, let's get you to a cardiologist for a risk assessment. So I think it's really making that team as broad as we can, because cancer can affect every organ system and often does. And so we have to then think about who we need to pull in as part of our team. And I think it is hard sometimes for patients because these things they're expensive in some cases. Insurance doesn't always cover. They take time, and you're just maybe getting back to work, and now you're like, well, wait, I have to go to therapy 3 times a week. And so it's also about thinking about what's a priority right now. What can we focus on in later? So it's an evolving conversation. It's not a one-time thing, and it's multiple people that are going to help move the needle forward in that.
Yeah. And I think that's so important that you said that idea that it's long-term. I can say, even just hearing you say that, having been through that and like a complicated medical history, there's a part of me that says, okay, I'm done. I had my surgery. I had my reconstruction. I've been through my appointments. So I'm done. Like, I actually don't want to do any more. Like, I'm going to ignore it. I'm going to ignore any other appointments I need to do because I'm just really tired of dealing with it. And I think that idea of having someone who is the head of your team or that you can go to and be honest about that, but still advocate for yourself is just so important. And I'm guessing that relationship has to almost be built from the very beginning when you first see someone.
Exactly. And it evolves over time. And I think what you said is really important. There's just a lot of burnout of like, I've just spent, 6 months going back and forth to doctor's offices, tests. I don't want to do anymore. I need a break. And so I think it's okay to say, these are topics, the survivorship piece is really important to me. Can we revisit it in 6 months? And I have so many patients who they're in 6 months or 12 months, they're now in that frame of reference where they're a little past that acute point that they kind of say, can we go through what happened? Can we go over my diagnosis again, right? Because when you're newly diagnosed, you're just, and I'm sure you can relate to this, you're in survivor mode, right? You are like fighter, like, what do I need to do? Get me there. And then when the dust settles, you can say, all right, let me make sure I understand what my diagnosis was. Let's go over this again. And then you can start to unravel these things of, what am I at risk for in the future? And a lot of our patients go through premature or early menopause. And so thinking about, what you're feeling. And the other part of it too is that the symptoms will change over time. So just because you don't have something right now, in 6 months, you may have a new symptom or that symptom may get better. So it really is that relationship. And this is why it's so important to have a relationship with your oncologist or your healthcare team that is, that really feels like this conversation and this back and forth that you feel comfortable with, because it is not a one-time thing.
Yeah. And would you, because I'm guessing there are people listening who are thinking to themselves, well, this was 10 years ago for me, or even 15 years ago, and I lived in a different state and I had to take the mental time away from it. but now I'm noticing I am having some symptoms from that. Or, radiation. As a PT, we see that so much. Had a lumpectomy, and radiation in the scar tissue now is really starting to bother them. What would you say to those people listening who aren't going to go back to see their original oncologist, or it's been so long? Like, what can they do to take that next step if they feel like they need support at this point?
Well, it's never too late. I think that, and you're right. And sometimes your oncologist in that acute moment of treatment
Mhm.
may not be the person who you later follow with, and that's okay.
Okay.
The nice thing now is that survivorship really is becoming more talked about. I think we have a long way to
Mhm.
go, but we're much better than where we were, years ago. And so, if you're depending on where you live, and if you want to find someone, you can go, all the cancer centers have websites, and you can see some of them will even say like these are our survivorship people, or
Mm.
try to find a survivorship center that you can
Okay.
see and talk to. And a lot of it is really it used to be we used to give people these survivorship care plans where
Mm.
it was you kind of had to do that, and you had the chemo you got and the doses you got, and now it's much more than that. It's thinking really, how do we think about your bones and your brain and your
Yeah.
heart, and what do we need to do about that? I mean, I can't tell you how many people are not getting regular bone densities,
Yeah.
after being on medicine that affects their bones, or
Mhm.
they were given these high risk cardiac medications. And
Mhm.
so it really is individual, but it's not too late ever to have that
Okay.
conversation.
That's so great to know. And I can say I think I was one of the lucky ones with my oncologist. From, yes, the moment I went in, I said, okay, she's going to take care of me. Whatever I think to ask or think to not ask because I forget, I'm like, this is someone I can go back to. And I know one thing, and this was amazing to me. I mean, just again, in the midst of not thinking about any of this at the time, she said, okay, these are some questions you might have going forward in a year or 2 years. I was 46 years old, I think, when I was diagnosed. And she said, at some point you'll want to talk about HRT. And there are options now. So don't put it to the side when you're ready to have that conversation. There are options available to you. And just, yeah, having someone lay that on the table to even say, you know what, that's something I can deal with later. And she can come back and have a conversation with me about, was so helpful. And so, with that, I would love to hear your thoughts on this large topic that I think we could talk about for weeks.
Yeah,
Like, we could have
for weeks.
episodes. Yes, I know we could have episodes just on this.
Yeah.
Um, I just feel like I'm getting more and more questions about it personally, and I'm seeing so much information about it. And I know it's different for everyone, but talk us through, and we can kind of hit different pieces, but
Yeah.
talk us through a little bit about HRT and breast cancer. And feel free to go back to that original study if you want to go back and tell us the history of how we got where we are now, too.
So it's a big topic. It's a
Yeah.
topic that we can talk about for a long time. And I think the one line take home is, things are changing. I think we're becoming a lot more open about breast cancer survivors taking menopausal hormone therapy or HRT. The big study, right, that the study 20 years ago that made its way all over every media headline was the WHI, or the Women's Health Initiative study. And I won't go into too much detail, but that was basically looking at, well, the risk of menopausal hormone therapy in patients who had not had breast cancer.
Mhm.
So it wasn't looking at people who've been previously diagnosed. And the study, we now know, was misinterpreted. But at the time, splashed all over headlines, hormones cause breast cancer, and everyone just pulled, that's it, you can't,
Mhm.
no one was given HRT. And it's really taken 20 plus years to start to move the needle forward. And it really turns out that estrogen alone does not increase HRT risk, and estrogen plus progesterone has a slight increase in HRT risk, and in breast cancer risk, and you need progesterone if you have a uterus. But to
Mhm.
compound that, that is older formulations of hormones that we don't really use anymore. So it's actually hard to know, well, what are the newer formulations,
Yeah.
right? Do they have that risk, and so what is that going to look like? And so I think the tides have really turned, and much more people are comfortable with, really now we have that accurate interpretation of that data. But for patients who have had breast cancer,
Mhm.
again, there's a lot of controversy here. we were pretty comfortable. We're comfortable with vaginal estrogen for patients. Okay, so that it doesn't get systemically absorbed. We do want to use low dose vaginal estrogen. Sometimes we use a non-hormonal vaginal moisturizer, either first or with the vaginal estrogen. But yes, we are comfortable with vaginal estrogen, and it can be a game changer for patients. So
Yeah.
when we're talking about HRT, we're actually talking about systemic hormones and not the local vaginal estrogen. For patients who have only a family history or who have a genetic mutation but haven't been diagnosed, we're really much more comfortable here. And again, these are individual discussions, and you really want to make sure that you're talking to someone who's a specialist who in both the oncology side and the menopause side, and people who, so I see a lot of patients who are thinking about HRT with their gynecologist, and I'll see them to kind of put my, oncology perspective into it. If you've had triple negative breast cancer, the data really does not suggest an increase in the risk of recurrence, which is great. And sometimes we'll wait until someone's a little further out from diagnosis, but again, individual. And then where there's still a contraindication relatively is in patients who've had hormone receptor positive breast cancer. Now, again, the problem is we have the studies that we have are old. They're not great. We have some studies that showed no risk, some that do show risk, and so it's it's a hard discussion, and it's a discussion that really requires us to sit down and going over the data and then thinking about, all right, what are the side effects that we are thinking about HRT for? How do we manage them? And there are so many ways to manage all of the side effects that aren't HRT. So for patients who can't take HRT, who choose not to take HRT, who often feel left out of this conversation, there are so many things that we can do. And so I put that out there because for every side effect that we can manage with hormones, we also have great ways that we can manage it without hormones. Yeah. One of the things that I'm really excited about is this hormone formulation called Duovi, which acts is in clinical. I mean, it's approved right now, but there's some ongoing clinical trials of it. Actually, one in DCIS, which is we're excited about. But it's an anti-estrogen in the breast and uterus, and then a pro-estrogen anywhere else. Wow. So, the formulations are changing. So I think that the conversation in 5 years from now is going to be different than where we are today. But I think for patients who've been told a blanket no, and who maybe it's only a family history or genetic mutation, I think it's really important to make sure that you're talking to a menopause specialist that really can break down that data for you. And I do think that oncologists are slowly becoming more open to the conversation, but we need more research, but we're it's moving slowly, but it's moving.
Yeah. I love all of that. I feel like there's two sides right now of the fear that obviously is there. I mean, we all grew up with it. Like all of us have heard it for 20 years, right? Like, no, no, no. And so many people have that fear. And then there really is kind of developing another side of everyone on estrogen, it's going to save your life, which I've read the research. I mean, there's a lot to say for that, but you're right. There's this middle ground with a lot of us where we do feel like, gosh, where do we fit in this conversation? And so just hearing you say, just knowing it is a conversation is really empowering to me, knowing that there are options. Maybe it's not estrogen, maybe it's not traditional, but there are options. There's vaginal estrogen. And so just anyone listening, hear that you want a practitioner who's willing to have that conversation with you and also who knows the data. And so if they don't, like, that's what I would say. If they're just a hard no or a hard yes and aren't willing to have that nuance with you, that's probably your key to maybe find someone else to have a conversation with.
Yeah, and I think I agree with that. I think what's really important is ask to see the data, right? And say, I'm being told that I can't have it. Can I come in and can we have a visit where we review the data? And patients deserve to see the percentages, the numbers, the studies, because I think then when you go through it, and it doesn't take a long time, but when you go through it, I think it at least helps people to understand the reasoning and the rationale behind the recommendations. And one of the things that I urge everyone all the time to do is make a specific appointment, a separate appointment,
Mm,
focus on that, because you may only have a 15-minute appointment. There's so many things that you have to cover, and if you have 30 seconds and you're asking, it's a bigger topic than that. So
yeah.
if you know I'm going to make a separate appointment to come in and talk about this, you have that time just for that where you can really get all your questions answered. And I recommend that for a lot of things because unfortunately if you work for, you're confined by limits and time, and so having that protected time is really important.
Yep. And just to say too, like you said, with the data, bring it, like you can bring it in, you can print things out, but just make sure it's from a source that has the letters behind their name. Like go to Eleonora's page, there, find people who really are using those scientific studies and also finding the new things that are coming out. There's a lot out there, and for every amazing thing I see of great information, there are things that are just going on that wellness fear kind of front. So you have
Yeah.
to wade through it a little bit. And it can be hard when you're in the midst of a diagnosis to do the waiting. Like that can be a hard thing.
It's really hard. I mean, it also requires, it's not just health literacy. It's, one of the things you get taught as you go through this is how to interpret studies. And so, you can have great studies get published and studies that, maybe have a small number of patients or have a lot of limitations in how that data was collected. And so this is why I urge people to take all that information you get online, collate it, bring it in, but you have to have a doctor that you trust that knows your medical history, because sometimes a study may not be applicable to an individual because, they didn't look at people with that medication or with that type of cancer. So having a doctor that is willing to have that conversation with you is really important.
Yep. And what are your feelings? And this might be a big question. I don't mean it to be, but I know there's so many great resources online now, like an Alloy. And I've gone there myself just to look at what they have. They have so many great resources and doctors on staff, but it is something that's virtual that you aren't necessarily having that individual conversation with a doctor. How do you feel about those resources for people who have been diagnosed or have a family history of breast cancer?
Yeah, I think, I will say, I think Alloy, and there are other companies out there, but I think what they're trying to do is really important. They're trying to make these conversations accessible because it is hard and sometimes it does need to be virtual. And so I think that it can be really, really helpful. My recommendation always is, I think that they provide fantastic info, and they do, have you those one-on-ones, but you want to make sure that everyone on your medical team is on the same page. That's, for me, that transparency is really important, because I want to know what my patients are taking. And so it doesn't, we shouldn't work in silos. And so if you're seeing a menopause specialist through Alloy, you're going to have them, you're going to have your gynecologist maybe who's doing your pap smears or your pelvic exams, and then you have the oncologist, and everyone should talk. And my take home is, I want you to see whoever you want to see, but I would like to talk. I want us all to talk, right? So if someone's seeing a functional medicine doctor, amazing. Before we're adding things to your regimen, I'd like to speak with them or at least see their notes, right? So if everyone's open and transparent, I think that's the best way for us to take care of people.
Yeah. And with you going, I know you talked about social media and wanting to use it as that education piece, because I know, it's just apparent by what you do, how important it is to you to get the information out, empower people to make their own decisions, take it to their healthcare team. I know you do a lot of talking on panels. Other than what took you there, like, do you have a specific goal in mind? Because I know you're still busy seeing patients. So adding the social media piece, I know, is a lot of work. Do you have a specific goal with that, or what keeps you excited to educate on that platform?
Well, really, I think the big part is to help people be their own advocates, right? And to be able to feel better after a cancer diagnosis. But also, I think it helps my patients, because, if people come in and they already, if they're like, all right, I read about tamoxifen, I researched aromatase inhibitors, I know these are the questions I'm concerned about. I think it helps people when you've read about it and you have heard more and more. the more you hear about it, right, the more comfortable you are, the terms, and I think it just helps people be better, have a better understanding of why they're taking certain medications, what the side effects can be. So I will say it actually, I think, really helps me provide medical care to my patients, because they've come in and they've read a little bit, they've heard more, but really the bottom line is I want people to take ownership of their health. And you can't take ownership of your health unless you are empowered and educated. And there are so many great resources online, and there's also a lot of misinformation. And that was something else that I really focus on, is how do we combat the misinformation? Because for every person saying, get your mammogram, there's someone saying, don't get a mammogram. And, my goal is the more evidence-based voices we can have online, hopefully that will help people, because we know, and we've seen this in shows like Apple Cider Vinegar on Netflix, right, that promote, that kind of highlighted the dangers of this, that, of not practicing evidence-based medicine or pursuing alternative medicines that can be harmful can lead to worse outcomes.
Mm-hmm. And where do you kind of see kind of breast cancer going when it comes to research, when it comes to survivorship, when it comes to community? Do you have some ideas in the next 10, even 20 years of what that might look like?
I think it's going to be completely different. And I always tell my patients when, I say in 5 years, it's going to look totally different, because it already looks totally different than it did in 2020. And I think we're really at a turning point where we're, 10 years ago, no one talked about these topics. And now, they're much more prevalent. And so I think we're getting, as patients are living longer, we're really and we're really starting to think about their quality of life, which is important. I think we have a long way to go in treating stage 4 cancer and metastatic disease. I think still 40,000+ women dying every year. And so we have a long way to go, but we're getting there. And sometimes progress feels really slow. And sometimes it feels really fast, but it's moving. But I think we're going to get better at addressing symptom management. I think we're going to get better at figuring out who's more likely to have a recurrence and who's less likely to have a recurrence, and tailoring those therapies. We're going to see newer medicines. So lots is happening. But it takes time.
Yep. And since we kind of covered mammograms, I would love to hear from you, because we get different information. What do you recommend to women when it comes to screening and any screening tests that are important to you? When should they start thinking about it? When should they start?
Great question. The important point is that screening is for the asymptomatic individual. So if you have symptoms, this doesn't necessarily apply. For anything, it's really important to know your risk. So if you're a high risk for breast cancer, if you're a high risk for colon cancer, for cervical cancer, whatever it is, you need to know that, because then you no longer fall into the average risk category. So in the breast cancer category, I always think you want to talk to your doctor about breast cancer risk assessment. And this is more than just family history. This is all the things we look at: genetics, personal medical history, reproductive history, all these things that go into it. And then based on your individual risk, you'll be given in specific guidelines. Now, for the average risk woman, we recommend starting at age 40 with the mammogram, and every year after that. And if you have dense breasts, considering supplemental screening with ultrasound or MRI. That's kind of the general one, but it's going to differ a little bit based on each person's individual risk. And this is why, again, talking to your doctor is really important, and making sure that someone is assessing that risk for you.
Yep. And just because I will always say this, anytime I have a chance to, women, go get your mammogram. I was asymptomatic completely. I have no family history whatsoever. And I had been getting mammograms every year since I was 40. And at 46, it came up, and it would not have without my mammogram. It would not have shown, because I had no symptoms. So go get your mammogram.
It's such an important PSA. One of the things people tell me is that they're like, but all my mammograms previously were normal. How could this happen? And, the point of the mammogram is to pick something up at its earliest point, but prior mammograms don't say you won't have something in the future. And so I say this because sometimes people get busy and life gets in the way and they say, well, I had 3 negatives, like I can skip this year. Don't do it. Take the few hours, really prioritize yourself. We think about self-care and wellness. It's not, it's not the bubble bath. It's not the massage, although those are fun things too.
Yeah.
It's, how we take care of our body. And one of those ways is getting the appropriate cancer screening.
Yes. And I think too, trusting that it's there for you to be able to take the best care of yourself. I think, like you said, with misinformation, there's just a lot out there. There's a lot of information to wade through, and just understanding that sometimes it really is putting trust in something you don't always want to do. I don't want to go get my mammogram. I don't want to do follow-up screenings, but I'm going to do it because I have trust that it's the best thing that I can do for myself. And you take one step at a time. And then whatever information you get back from that, you take the next best step. You don't have to think farther than that, but just one step at a time. And yeah, I truly believe it can save your life.
Well, it does, 100%. And it's just such an important test. And it's more than just mammograms. It's all the other cancer screening that we should be doing for ourselves.
Yeah, colonoscopy is next on my list. And so that I can't say, but it's coming. It's coming. What else, as we kind of wrap up, are there any other topics or anything else that you want to share that kind of does wrap up what we've talked about today?
I get asked a lot from patients saying, all right, how do I take care of myself in survivorship, right? And that's a really broad question. Or I get asked, well, how do I manage the symptoms? And so it all depends on what the symptoms are. If you have hot flashes, okay, we're going to talk about that differently. If you have vaginal dryness, if you have mood changes or brain fog, right? All those things are going to be different. And a lot of it too, how it works for one person may not be how it works for you, right? Because there's so many other factors that go into it. What medicine are you on? What were your other medical issues? But my best advice is make a list. There are really, it's more than just menopausal symptoms for survivorship. There's so many things, right? Write down, make a list, and slowly think about what are the most important things on my list right now, and making sure that when you come to your appointments that you are, prepared, because it will help the appointments, help your doctors help you. And I also want people not to get discouraged, because sometimes it can feel like I went through all of this and I have all these issues and it just seems like too much to address them. Don't get discouraged, one step at a time. And then we really didn't touch on the lifestyle pieces, and there's so many of them. But I'm going to give you 3 things that are that I tell everybody. 1, limit your alcohol use or eliminate it completely. It just makes everything worse. It can make hot flashes worse. It can make sleep worse. It can make brain fog worse. So limit, eliminate. Number 2 is movement. Movement is medicine, right? And start slow. It can be a 5-minute walk, and then you build that up to a 10-minute walk. Start lifting weights, and again, ease into it. But movement, so many benefits. And then diet, right? What are we eating? How are we eating? What foods are we eating? Everyone's on a protein kick right now. I love fiber. I think fiber is like this underutilized. It has so many benefits. So fiber, limiting added or processed sugars, limiting ultra processed foods, knowing what you're eating, right? Look at the ingredients. If there's 30 ingredients and you don't recognize half of them, maybe you have that once in a while, but that's not a day-to-day food for you. So I think that all of those, it's a lot, but it can help us feel so good about ourselves.
Yes. And I think that's such a great point in this kind of oncology world, but also, like you said, just when we're talking about hot flashes or hormone changes, the more I dive into it, the more I'm learning that, again, the research shows that these kind of lifestyle changes need to be the foundation of anything else we do for our hormones. And like you said, for so many of us who maybe we aren't systemic HRT candidates, but look at these other things we need to be doing. And I can say personally, that's hard. There are times you want to say, no, just give me that pill instead. I don't want to change that about my lifestyle. Or it's really too hard to shut off my screens at night and shut down the blue light. So I'd rather just have this cream. And I think they can work side by side, but the lifestyle changes aren't just this flippant extra thing. It is the foundation. Like your nervous system, nourishing yourself, doing all of these things have to be the foundation,
Yeah.
I think, for everything else.
I mean, we didn't even get into sleep, but that's huge. But I think, and I'm a 41-year-old woman in perimenopause, so I live this every day,
Mhm.
and I just think about what helps me feel better, right? I mean, also things like for my heart and cholesterol and blood pressure and all that, but I think about what helps me feel better, and I think about what are the things that I can do on a day-to-day basis that help me feel better. And I know when I eat better and move, I feel better than when I don't. And it's hard to do it. It's easier to reach for the cookie, or the donut or the extra screen time. But again, and once in a while, those things are awesome. But what are we doing most of the time for
Yeah.
ourselves?
And have you seen, I will say just personally, probably the thing that affected me or what I noticed the most during my journey when I was diagnosed was the power of community. I mean, it's such a
Yeah.
strong community. And honestly, the oncology community in healthcare, I'd never seen anything like it. And I've even been a part of it as a PT, but I hadn't as a patient. It was such a powerful place and such a powerful community, and the people who've been through it. Have you noticed that as well? And do you find that that contributes to how people go through this journey, is just whether they can tap into the power of community?
Community is everything. Having people, and this goes for anything, I think, not just for cancer, but you want to be part of a group where people have similar experiences, right? That you can talk to and relate to and understand what you're going through. And so I think in the cancer space, there's so many amazing communities. And I do think that is one of the benefits of social media, that you can find a community for yourself. You can, based on the type of breast cancer, there's communities, groups on Facebook for each drug people are on. And so, I mean, it's really wonderful because you can connect with people, you can get information, and sometimes you might be saying, I'm feeling this, like it feels like I'm the only one, and then you stumble into this group and everyone feels that, and you're like, oh, I'm not alone, right? I've been validated. And I think it can be so helpful to have people in your corner that get it, that you can talk to, because people in your life want to help, but unless they've gone through that, you don't have that lived shared experience. And I think it can be really, they're helpful and they want to help, but they don't totally get it.
Yes, 100%. And I've seen, again, so much on your social media and panels you've been on, and with the Breasties organization, I've seen you talking, and there's so much power in just knowing you aren't alone. Like whether it's a personal friend or just someone online or a colleague who reaches out to you, I would say yes, take the help, bring people to your doctor's appointments. That's one thing I wanted to say. I tend to recommend that when you said write down your priorities. See if you have that one trusted person, your one safe person, and take them with you. Like you're not going to remember everything when you're in the midst of it. It's too much. Have someone there to hold your hand, but also to take your notes, to like remind you afterwards what you heard. So yeah, whether it's one person or a community of 30 people, I think it's really important just to, yeah, have that one safe person with you. You know, you aren't alone.
And I will add two things to that. One, they can be on FaceTime or speaker if they can't be there.
Oh, great to know. Great idea.
It doesn't need to be your spouse or your parent or your child. It can be, sometimes it's actually better if it's someone a little bit more removed, because they don't have as much of that personal, they're just there as really the non-biased party. And then sometimes people will say, I really don't have anyone to bring, or I just don't have anyone to bring. And this is where the community is so important. I've had people who've reached out to the local Facebook group and say, I've been diagnosed with cancer. I need someone to come to my appointment with me. And people show up. And nothing is more heartwarming than someone who just shows up for you and they've never met you. And, and it's because they've been there and they remember what it's like and they want to come and help. And so I think that sometimes it's hard to ask. Sometimes it's hard to extend that hand and ask for help. But people want to help. And there's moments like this where I'm really always just reminded about how good people can be and how helpful people want to be. And I think just ask, reach out and ask.
Yep. That is an amazing thought. And for anyone listening who's maybe looking how to support someone in your own life, because I get a lot of messages from people. Just yesterday, a friend out of state was diagnosed. How can I help? And we'll have some resources below. I mean, you can send gift cards, you can do all those kind of things. But yes, I think those kind of ideas is, hey, Can I drive you to this appointment? Can I walk into this appointment with you? Can I research something for you and print it out for you to take? Those kind of things can be really helpful when someone's in the midst of it and is just overwhelmed by decision making.
Mhm.
I think that's a great idea. And I love the FaceTime idea too.
Yeah.
That's really good. Yeah. Thank you so much. Tell everyone where they can find you, other resources you have.
Absolutely. So I'm Dr. Teplinsky on all social media platforms. I know you'll link it. I
Yeah.
have a podcast called Interlude where I talk to cancer experts and people going through it, previvors, survivors, thrivers, and it's a way for people to just listen without maybe necessarily feeling like you have to, sometimes it's hard to participate and you just want to
Yeah.
listen and hear people's stories. It's just a passion project of mine and I
Mm.
love connecting with people that way. And I have a book coming out in 2026
So
called
exciting.
Beyond the Pink, which is like everything we talked about, right? All the ways that you can take care of yourself, during and after a diagnosis. All the things we don't talk about, but we need to.
Yes. Oh, I'm so excited. That is going to be so needed. So we will link all of these things below in the show notes. Thank you so much. I just can't thank you enough, personally, as someone who's been there, and then also professionally putting good things out into the world. So thanks for being here.
Thank you so much for having me.
Mhm.
Loved
Yep.
loved our conversation.
Thanks. There we go.